you doing? How you doing? Did you lull those babies into a sleep? Well, except that one was plugged in. Hi. How are you? How are you today? We're going to go see our friend Dr. Henderson at 2 o'clock. Hi. Oh, look what I have for you. I have some of this. Want that? Should we deworm some of these wormy babies? Hi. Hello. Hello. Alright, let's see dosages of this. 1 cc per 5 pounds. Okay. This is in ounces. Oh, hello. Oh, right, 15 pounds. So, Prancy Pony Paw. I'm getting a Prancy Pony Paw over here. I can calculate dosages with one hand and pet Miss Dorothy with the other. That is what I can do. Need to get you a pretty hairbrush, don't we? Yeah. Oh, so pretty. All right, so did you hear that there's been a sex change over at the critter room? Pretty funny. All right, you guys could use a clean blanket, couldn't you? So let's deworm and we'll do a clean blanket. Let's try pink. You look very pretty with those babies in pink. All right, so we start deworming when babies are 2 weeks old, which they are today. And we do it every 2 weeks until they're adopted. For every kitten in the shelter, and every cat also. we do lots of deworming because as you can see from what happened with Dorothy, parasites can do a lot of harm, and every cat that comes to us has parasites of some sort. All right. So we deworm the tiny ones with something called Strongid, which is safe for babies. The lid's not on tightly. There we go. Ooh, I just Strongided myself. So, maybe there's a hole in this. Well, I've been sprayed with worse things. Alright, here we go. So, who wants to go first? Where's Mr. Henry? Mr. Henry, you ready? Good job, buddy! They don't mind the taste of the Strongid, generally. Alright, Henry. It's done. Where's Mr. Toto? I feel like that's a face of a Toto and the body of a Toto. Hey, buddy. Ready? It's so this is what Strongid looks like. It's a yellow liquid. Safe for little babies. Safe for pregnant moms. Who's next? Mr. Ozzy. And it's good at roundworms in particular, which is something that we assume every cat and kitten has. Very, very common. Oh, good job, buddy. Who's next? Munchie. Munchie gets a little bit less than everybody else. It's very important to deworm with something that is safe and appropriate for little kittens or pregnant moms. Stuff you get at like Walmart or the grocery store can actually be bad. Like harmful for them sometimes. I know, I'm stealing your babies. Marvelous. Okay, I have a lap full of kittens. I know I stole They stole your babies. He's fine, Mama. He's fine. I will deworm you too, but I'm going to wait and see what Dr. Henderson says first. And last but not least, Mr. Nico. Oh, someone's very squawky. He's not bad, is it? There you go. Good job, team. All right, ready? Take out the old blanket, put in a clean blanket. Wait, Mama, wait. There. There. See, that's nice, isn't it? Nice and clean. See? I'm very squawky. So, in case anybody missed it, we will be going to see Dr. Henderson at Mountain View at 2 o'clock with Miss Dorothy. I may bring a few miscellaneous other kittens. We'll see how everyone's doing. Or I may just bring Miss Dorothy. Oh, hey, Mr. Marvelous. Look at Toto. He's the cutest. Oh, so cute. Hey, buddy. Look at the little silent meows from the Toto. Just kill me. He's so cute. He's so cute. With his little floof mohawk. Look at his floofy mohawk. So, and Dorothy was tested for feline leukemia and FIV and was negative, so that is a good thing. She does have an overabundance of a normal bacteria called Clostridium perfringens, and when Clostridium perfringens is out of balance, it causes diarrhea, and it is a very common result of having parasites, which, as you know, she had plenty. So, and we can't treat her with anything, with any of the normal treatments while she's nursing the babies. So we may be starting her on some vitamin B injections. She has been on probiotics, which had been helping until the last couple of days. She seems to have, she was definitely feeling better. Now doesn't seem to be feeling that great again. So We shall see what Dr. Henderson thinks. And one of the good things about monitoring the weights of the kittens so closely is that it's normal for them to have kind of a big day and then a small day and then a big day, and they can certainly have fluctuations, but when all of them have a couple of slow days in a row, like when I weighed them this morning, they hadn't gone up, and yesterday they didn't go up really, so that to me means it is time to take some action. There aren't any major losses. That specifically has me concerned, but just the general trend is not something we like to see. So that to me is an indication that either she's not staying in the nest long enough for them to nurse, or she's not producing enough milk. So we'll see what's going on. And if I need to, I will supplement more of them than just Marvel, because Marvel's the only one that's had some nice steady gains. So we have done the standard fecal flotation and a full diarrhea panel, and there was no evidence of coccidia in either. You are correct that coccidia in a fecal flotation can be elusive, so you can't really ever 100% rule it out, but the Clostridium perfringens is definitely consistent with how she's feeling and acting, so hopefully it's nothing more than that. It can also come and go. It can seem like, look at this with this. It can seem like it's better one day and then worse the next. So that's fairly consistent. I just want to see what other options we can explore for getting her feeling better. So since we can't give her the usual meds, or if we even need to, if it gets to a certain point, if it's worth separating her from the kittens for a couple of days and giving her some meds. I don't think we're to that point yet, because I still think it's in the best interest of everybody for them to be together from a stress perspective. And I still think we have some other options we can try. So that's what we're going to do. And I'm sure Dr. Henderson will investigate any other potential causes. The Clostridium perfringens is something that definitely will go away, and there are meds for it that will help it go away faster. It's just unfortunately not something that is safe for us to give her while she is nursing babies. So we always have to be very careful with pregnant moms or nursing moms, that knowing that whatever we give them is going to be passed on to the babies. And especially when they're so young, there are very few things that are safe for them. She's due for her deworming today also, but I'm going to wait and talk to Dr. Henderson and see what she recommends. She's had 2 rounds of Revolution, which is primarily for fleas, but also has some deworming effects. She's had 1 round of Profender, which is for tapeworms. And so I was planning to do her 2nd round of Profender today, just to make sure that she didn't get reinfected with tapeworms, which is totally possible. This is why we deworm every 2 weeks, because it's so easy for them to reinfect themselves. Because of course worms lay eggs. In the case of tapeworms, this is a little bit gross. If you don't want to know, just mute for the next few minutes. The tapeworm inside of the cat is a segmented worm, and some of the segments will break off, and the segments are full of eggs, and the segments will emerge and be crawling around, and will get in the bedding and the carpet and the, litter box, anywhere really. And then when she's grooming, she may eat one and then she reinfects herself. So pretty easy to do. So that's why we deworm so much. And we also try to deworm for all of the common worms, like roundworms are probably the most common, tapeworms. So the diarrhea panel checks for a bunch of things. Giardia is one of them. She was negative for that. So, and she also came back negative. Her last fecal came back clean for roundworms and all that stuff too. So Dorothy's probably in pretty good shape. The only thing I would be most suspicious of is possible tapeworm reinfection, but we'll see what Dr. Henderson says. So the Strongid that I gave to the kittens is very good with roundworms, which are, like I said, the most common. And then we don't do Revolution until they're 6 weeks old. Although they should not have any fleas because she's been treated twice now. She definitely had fleas when she came in. So again, it's possible that when she came in with fleas, she dropped a couple of eggs. It's possible there are a few fleas that will hatch. So again, it's always good to treat them for several months in a row to make sure you get everything. Alright, let's see. So bottle feed. Next bottle feeding is probably soon. Yep. So I'll probably do the next bottle feeding around 11:30 or 12. We're going to the vet at 2 p.m. our time, so it's 11 a.m. right now. Such a good mama. Such a good mama. Want to try a bite of food? Not so much. All right. Well, we will get you all straightened up. She did actually eat a good amount last night, and she drank a nice amount of water too, so that is good. So she has been eating a little bit, just not as much as I would like for her to be eating. All right, everybody, I shall see you shortly.